All right. Good morning, everyone. This is Ron Brown. I'm giving this presentation to the user group in Texas, PC user group. This is called Saving Your Life with Wearable Technology. It is being recorded, and I'll send you a link this afternoon for the recording. And if you look on the screen, you'll see my website, which is www.techforsenior.com. If you go there, you'll also see all the other presentations that I have available. And I've just completed part 2. This is actually part 1 of a 2-part presentation, and part 2 is now available for presentation. So the goal of this presentation is to identify 2 common medical conditions that will lead to incapacitation or stroke. How wearable technology can help you identify these conditions and seek medical help. Now, a disclaimer, the views of this presentation are not the views of any organization. It's not meant to be any personal medical advice, and you should always check with your healthcare provider before changing any treatment plan. The people in this presentation are fictitious and do not portray any member of our community. That's just so to keep the lawyers and legal people happy. Now, I did give this talk, you don't have to read this, but I did give this talk to a group in February. One of the individuals in the group followed through with my recommendations, ended up in the hospital overnight, and the cardiologist who attended him said that if he hadn't come in, he would have certainly passed away that night. So I got a very big thank you from him and a very big thank you from the resort. So the presentation at least has saved 1 life so far, and probably many more. I wanted to talk a little bit about what is wearable technology, and wearable technology is big business. If you go to Best Buy and you look at Best Buy, you'll see a large part of the showroom will be wearable technology, and by the year 2026, we're looking probably about $66 billion worth. If you look, and we're going to be talking a lot about the smartwatch today, if you look up here to the left, you'll see that the smartwatch is comprised about 17.9% of the total wearable technology. It's interesting that earwear, such as earbuds and stuff like that, are actually 40%. But the watch industry is certainly a big part of that. And in fact, Apple shipped in the last quarter of 2019, shipped 29.5 million watches in 1 quarter. And this was a 200% increase in the market, 200% increase since the previous part of last year, and represents about 35% of the market. So Apple is selling a lot of smartwatches. Now, if you look at the wearable technology field and you look at who are the leading people in the wearable technology, you'll see there's 3. The first one, of course, way ahead of the pack is, of course, Apple. Coming up close second, well, not a close second, but the second would be Samsung. And the third is Fitbit. Now, it's interesting that, as you know, last year, Fitbit was sold to Google for $2.1 million. Fitbit really had a lot of trouble capitalizing, and although they made lots of watches and lots of models, they really didn't have the financing to make the final switch and make it into a medical device such as the Apple Watch. So there's a number of things that have happened, and Fitbit is now owned by Google, and we'll talk about some of the changes that have occurred and some of the changes that are occurring with that. So we have Apple, Samsung, and Fitbit. Now we're going to talk a little bit about AliveCor. AliveCor is a company in the United States who pioneered a lot of the technology that Apple uses. They were able to come up with atrial fibrillation, the software that detects atrial fibrillation, and that's part of what Apple uses in their watches today. This is one of the chief medical officers of the company. and she was just hired this past year away from AliveCore to work for Google, and there were some pretty big changes that are occurring with the Fitbit line based on this individual's technology. As you know, there are a number of Fitbit watches out. Many of you have these watches. I have a Fitbit, and there's a lot of different models. However, these are mostly used for activity trackers. You know, they're doing your heart rate monitoring and doing a lot of stuff to do with activity, and they haven't really been able to do the monitoring such as we're going to talk about with the Apple Watch. However, that's until now. So what happened is that when they hired away from AliveCore, they looked at the software in the Fitbit watches, and they found out that in fact they could do a lot of the medical testing with the existing software in the Fitbit watches. They are now looking for people for a large national study in the United States. And if you own a Fitbit watch, you can participate in the study. And the link is on the left side here. It's fitbit.com/heart-study/product. And if you go there, and I know I just gave this presentation 3 days ago, and some people already signed up. They emailed me and they were really happy, and they signed up for this study. What this is looking at it's an atrial fibrillation study to find out if they have any cardiac arrhythmias, any heart. We'll talk a little bit about atrial fibrillation in a few minutes. And it's looking to try and identify cardiac problems. So if you're interested and you have a Fitbit, this might be something for you to participate in. This is the Apple. Apple has done 2 large studies in the United States. This is the current one that's being done. This is they completed the enrollment in this. A lot of people who I've given this presentation to have written me thank you letters, because if you did enroll in this study, you got a heavily subsidized Apple Watch version 5. And but the study's now closed, and they have recruited 420,000 participants, of which 25,000 are over the age of 65. And again, this is looking at, the study is to look at the, they want to show the reduction in death and mortality rates in people wearing the Apple Watch. And this is what this study is going to be working on. But this is now a closed study. So let's talk about a fictitious person. I want to go through this person, but I want you to think about this, and I want you to think about this person as I go and I discuss the problems that Mary has, and that these could certainly be related to yourself or your loved ones, or maybe your parents. And I want you to think about it, because we're going to talk about some of the issues surrounding this. So Mary's a 74-year-old widowed, and she lives full-time in Silver Ridge RV Resort in Mesa, Arizona. This happens to be the resort that I live in when I'm in Mesa, Arizona for the winter. And this is Mary. Now, Mary's lived at the resort for 7 years and has won the hearts of all the residents. Everybody has a Mary in their resort. She lives by herself. She's widowed, and she has a park model with an Arizona room, and has a very good friend across the street who she walks with every morning at 9 o'clock. Alice and Mary walk around the Silver Ridge perimeter and then stop for a cup of tea. Mary is very active and is a member of the pickleball club. I don't know about your area, but everybody in our resort always plays pickleball. They're pickleball crazy. Her highlight of the year is Monday morning, of course, when she comes to her computer club meeting. Now, I had to put that in there because I run our computer club. Mary's been widowed for 12 years. She has a daughter, Meg, who is an accountant and lives in Palm Desert, but comes to visit once a month. Mary has pretty good computer skills and Skypes frequently with Meg. Mary doesn't drive anymore and uses Uber for transportation. Now, Mary's health's pretty good. She sees Dr. Jones, who's been her family doctor for the past 12 years. She sees them just down the street. Mary's a little overweight, has a bit of a blood pressure problem. She recently saw Dr. Jones, who said her blood pressure was entirely normal. Mary agreed that she would try to lose a little bit of weight and play a little more pickleball. So her last checkup went pretty good. So on July 2nd, Mary is walking home from the mailroom and she felt a little lightheaded. She felt a little lightheaded and she sat down in the grass. And you'll see here, this is the grass where she'd be walking home in our resort. And she felt a little bit lightheaded. She had no chest pain or any palpitations. And John came by and in his golf cart, lots of golf carts in our resort. And John actually said, "Are you okay?" And she said, "Yeah, I feel fine now. I just felt a little lightheaded." And she decided, and he picked her up in the golf cart and took her home. And then, of course, called her later on in the day to make sure she was fine. So she said she had already talked to Meg and that she was going to see her doctor tomorrow and get checked up. Now, you can tell this is a made-up story because who gets to see their doctor the next day when they call, right? Highly unlikely that that's going to happen. But anyway, let's go along with the story. So Mary goes to see her doctor, and her doctor says, "Well, what's the problem?" And he said, "Well, I had this little bit of a dizzy spell." He checked her over and said, "Nope, everything's fine. Your blood pressure and pulse are okay." And he didn't think any tests were needed. So they decided to leave it at that. So again, Mary went home. She, a couple of weeks later, she was on July 17th, she was cooking supper. She felt a little lightheaded again. This lasted for about just a little short time, and then she had to sit in her lazy boy chair and the symptoms went away. Again, she went back to see Dr. Jones, who again found nothing really wrong. But he said since this was the second time she had had this, he was going to order some tests. So Mary said, "That's fine," but Meg was coming for dinner this week, so she said, "Let's do them next week." And he said that was fine. Now, what happened was Mary got up. The next night, Mary got up about 2:30 to have a pee, and when she was getting off the toilet, she got another attack. And this time she fell to the floor and she heard a crack in her right hip. She was in terrible pain and wedged between the toilet and the shower. She couldn't move and called for help, but nobody came because, of course, she lives in a resort. There is nobody in the resort in the summer. Out of 700 homes, there's only 50 people that live there. Alice, of course, came around to find Mary around 9 in the morning. And when she found Mary, her blood pressure was very low, her pulse was very slow, and she was extremely cold. On arrival to Banner Hospital, she had a temporary pacemaker inserted. She was then transferred to the intensive care unit where she was stabilized and had a permanent pacemaker put in. Her hip was repaired, and to the delight of everyone, Mary made an uneventful recovery. She is back doing her daily walks with Alice, but has given up pickleball. So we're going to talk a little bit about Mary and what happened to Mary and how we might be able to prevent this from happening again. So obviously this was a heart problem, and we're going to talk about your heart. Now, there are a number of things that can go wrong with your heart, none of which you look at it on the picture here we're going to talk about. The first problem that you can get in is plugged arteries. This is called coronary artery disease. This is often when you've had stents put in or you take medicine to lower your cholesterol. This is called coronary artery disease. We're not going to talk about that. There's also problems in your heart with valves. You got lots of valves just like in your car. Sometimes you need a valve job. Well, that's not the problem here, so we're not going to talk about valves. Also, sometimes you can get infection in your heart muscle. This is called a myocarditis. This is actually what happens a lot of times now in COVID-19, but that's not the problem here, and that's not what we're talking about. What we are going to talk about is the electrical conduction system of the heart. Now, I like to, I looked at everyone before the meeting, and you all are very smart people. So I'm going to be able to teach you what takes a year for medical students to learn. I'm going to teach you in 30 seconds what you need to know. All right, now on the right-hand side here, you see you probably will identify this as a circuit breaker. This is a circuit breaker like you would have in your house. Now, if you turn this circuit breaker off, the lights go out, right? If you turn the circuit breaker on, the lights come on. So it's the same thing in your heart. If you look over to the left here, you'll see this main electrical feed comes into your heart, and it comes to circuit breaker number 1. Now, if circuit breaker number 1 fails in the off position, your heart stops. Now, you all know that's a bad thing, right? So this is not good. If it fails in the open position, then you get too much electricity coming into the heart, and your heart speeds up and races, and that can be called atrial fibrillation. So the circuit breaker number 1 is either going to fail in the open position or the closed position, and that's all you have to know. That's it, open or closed, and that's it. All right, now, one of the things that's important as we get older, and we'll discuss why this is so, is that you know what your heart rate is. It's really important that you monitor your heart rate. And it's if your heart rate is too slow, this can be a significant problem. If your heart rate is too fast, it can also be a problem. So as you see here, we want to know if it's too slow or too fast. And there are many devices that you can wear around your wrist. As you'll see the people up here in the left corner, there are many devices that you can wear that will tell you what your heart rate is. But we really want you to monitor your pulse. That's so important. Monitor your pulse. Now, how can you, there are many devices, and we'll talk a little bit about these devices now on monitoring your pulse. Of course, as I told you earlier, the leader in the pack is Apple with the Apple Watch, but there are a lot of other devices that will measure your pulse. And so you could, of course, measure your pulse by feeling it, by palpating it, but this is not many people do that, and it certainly is a lot easier to have the device monitor it. And again, these devices are all sold as activity trackers, but we're not. But what we're talking about today are very specific subset of what these devices do that are for seniors. And the value for seniors really is not the fact that you can train for a marathon or do all these other things that these activity trackers do. The value is that you can monitor your pulse. We're going to talk in part 2, we talk about accelerometer and falls and emergency notification. But today, with this talk, we're going to talk mostly about your pulse. Now, why is this so important? Well, you saw Mary almost died, right? What Mary's problem is circuit breaker number 1 failed in the off position. Now, this is a problem because if you've ever had a car and you've had electrical problems in the car, you all know how complicated it can be to find that electrical problem. And it's not uncommon when you go to a doctor and you've had a little dizzy spell like Mary had 2 or 3 times, and they can't find the problem because it's an intermittent problem. But in Mary's case, she could have died. She could have died because she, in fact, broke her hip. She stood up, her pulse went way down, she lost consciousness, she fell, and she broke her hip. Now, she could have certainly died from that. And had she been wearing an activity device, and when she had that first dizzy spell, she would have looked down at her watch, and the watch would have said, gee, your pulse is only 45. If she had told Dr. Jones that, then it would have been much easier to come up with the diagnosis. So again, the problem in this situation is circuit breaker number 1 and a slow heartbeat because it was failing in the closed position. And you'll see this is circuit breaker number 1. Now, if you look at the incidence, and why is this so important, is because this is the incidence of cardiac pacemaker insertion. So if you are 60 years old, and watch the graph now, if you are 60 years old, look at the graph. The chances of you requiring a pacemaker by the time you get to be 80 or 85 is very high. In fact, it could be as high as 60 or 70%, depending. Most talks that I give like this, there are a number of people that have pacemakers. So in this particular time of your life, over the age of 60, it is so important that you monitor your pulse, because not only did Mary almost die because she fell and cracked her hip, but what if you were driving down the road and you suddenly lost consciousness because because of this condition, and you swerved and drove your car into a restaurant and killed a bunch of people? This happens, unfortunately, with great regularity. So please remember this diagram. We'll refer to this again. Now, the Apple Watch actually does a very good job for you. It says, hey, your heart rate is too slow, and it will give you actually a low heart rate notification. If your heart rate is beating too fast, this is called atrial fibrillation. And this is where circuit breaker number 1, this same circuit breaker, fails in the open position. And this causes a condition called atrial fibrillation. Now, in your heart, you have 4 chambers, and these top 2 chambers in atrial fibrillation just quiver. They actually don't contract down. And this allows clots to form in these top 2 chambers. And again, that's pacemaker number 1 failure. So you probably have heard of atrial fibrillation, but the big feature of atrial fibrillation is stroke. One of the major causes of stroke in over 60 is atrial fibrillation. And many times when I make rounds in the hospital and I'm standing at the end of a stroke patient's bed, the family's all looking at me saying, why did Dad have a stroke? Well, the reason Dad had a stroke was because he had undiagnosed atrial fibrillation, and it caused a clot. So again, if we look at the stats on this, guess what? Age 60, incidence of atrial fibrillation goes up again. And the graph sort of parallels the previous graph that I showed you, and that's because it's circuit breaker number 1 that's causing the problem. It's the same thing. It fails in the closed position or it fails in the open position. And this is called atrial fibrillation. And again, there may be most times when I'm doing this talk, there are many people who have atrial fibrillation. And this is a major cause of stroke in our age group. Well, guess what? The Apple Watch will tell you if you have atrial fibrillation. It has a atrial fibrillation detection on it, and it works very well. In fact, we'll talk about this in a minute, but it will tell you, and it does a very good job of telling you if you have atrial fibrillation. The first study that was done was at Stanford Medical Center, and this was the first Apple study, and they did this with a large group of patients and found that the Apple Watch does actually a very good job of diagnosing atrial fibrillation. This was a study done 2 or 3 years ago. The current study is not so much about diagnosing atrial fibrillation, but treating it and seeing if there is any treatment benefit. Now, I wanted to show you, this is on the right-hand side, you'll see this is an 1860. This is a ECG machine. Now, folks, in 1860, they were still burning witches at the stake. So this is in Germany. So I can just imagine the doctor who would send this rather worried person for an electrocardiogram in 1860. Now, if you look here, he has both his arms in buckets of water. He has his left foot in a bucket of water, and he's hooked to this contraption here, and they're doing some testing on him. Now, this is sort of an interesting, I find that picture very interesting, but it does talk a little bit about the fact that very early on, as doctors, we knew that if we measured the electricity in your heart, we could find out a lot of information. And if you look over to the left here, this is now, many of you have been to the hospital and you've had what we call an electrocardiogram. Now, if you have an electrocardiogram, it will show you, it will be something like this in the bottom left corner here, all these squiggles on a piece of paper. Now that's what you do go to medical school for, is to learn how to read that and figure out what that is. And why is it so important? Because when we do an electrocardiogram, we can tell how your heart has behaved in the past. We can tell if you've had high blood pressure, if you've had a heart attack, by looking at this piece of paper. We can talk about the present if you come into the emergency department and you have chest pain. By doing the ECG, we can tell if you're having a heart attack. We can also tell the future of your heart. We can tell if your heart is going to be, how your heart is going to behave in the future. So it has future predictability. So past, present, and future, we can get a lot of information about your heart. Well, the Apple Watch does an ECG. Yes, it does indeed. It does an actual ECG. So again, the Apple Watch must be paired with the Apple iPhone. So you must have both. You can't just use one or the other. But for example, if you look up in the top right corner, you'll see the index finger is pushing on the crown of the watch, and this initiates the ECG. The ECG is then done, and it's transmitted over to your iPhone, and it's stored in a PDF file in your iPhone. And this is what the ECG looks like, and it will tell you right away is if you have any signs of atrial fibrillation. What we're really trying to do is decide if you have atrial fibrillation. One of the things when Mary first had that dizzy spell and she sat down, she of course needed a pacemaker because her pulse was really slow, but she could have had a bout of atrial fibrillation and had the same symptoms. So when Mary got a little dizzy, if she had pushed the crown on her Apple Watch and recorded an ECG, this would have been immensely beneficial for Dr. Jones in figuring out what the problem is. So this is a very good feature on the Apple Watch. Now the ECG is not quite like the ECG that you have in the hospital. It's the one on the left side, you'll see this is a doctor-initiated ECG, which is complicated. The one on your phone is basically telling you, is your heart beating too slow, or do you have atrial fibrillation? It's not doing the past, present, and future stuff. It's not doing all that. It's just doing a couple of simple things that we want to know about, but it is extremely valuable. And so this is what it will, again, it's meant to be used with the your iPhone. And of course, on the Apple Watch, it will show, in fact, if you have a regular rhythm or if you have atrial fibrillation. It comes up and it gives you the specific information right there. Now, insurance companies are aware of this, and they're aware of the great potential of this device. And so now this is dated information. This was of I think November of last year, and some of the healthcare plans have probably updated it. But this company, along with these companies, will if you have your healthcare insurance with them, they will subsidize the cost of an Apple Watch. So they were recognizing that the value of this and the potential good it has, and so these companies. So if you are with these companies, or you know, this changes so fast, I would check with your healthcare provider, because they may also be willing to subsidize some of the cost for an Apple Watch. Now, further, of course, I said Apple is the leader of the pack. They're ahead of the game right now, which we'll talk about in a minute. But coming up second is, of course, is Samsung and their Active 2 watch, and this has the atrial fibrillation detection available in it. This is available currently now at Best Buy for around just under $300. This is the Android. This is, of course, an Android. We talked about Apple now and all the things Apple does. This is an Android watch. This is by Samsung, and this has basically all the features. Well, not all the features, but it has the atrial fibrillation detection, and it will also have blood pressure monitoring as a new feature coming out next month. Now, the problem with this is, and we'll talk about this in a minute, is that each each device and each function of the device has to be approved in every country by the equivalent of the FDA. So the certification of the for atrial fibrillation on this device is still waiting for the US FDA to approve it. And hopefully approval will come in the next couple of months, and then they can turn on the software. You see, since Apple is ahead of the game by everybody, they have gone to all the countries, most of the countries in the world, and have got their Apple Watch all approved for all the functions. Samsung's just starting that process now, and it can be a very slow, laborious process because you have to approve it in each country. We'll talk about that in just a second. Now, this is a company, we're coming back to AliveCor. Remember, we talked about that very early on, and this is a very interesting company, and it was founded by Dr. Albert. Now, what AliveCor has done, they've done a couple of things here. We have talked about the Apple Watch in diagnosing dizzy spells and atrial fibrillation. Is your heart too fast or is your heart too slow? Well, probably this device has been on the market. It's been on the market quite a while now. This is a device for $89 that will do exactly the same thing that the Apple Watch does. And let me show you how this works. So those of you who don't have an Apple Watch or an iPhone, you might have an Android phone, and you're wondering, what can I do, and how can I protect myself, or how can I help myself? And that device is available readily now. In fact, I think it's gone down in price. It's $89. I was watching CNN yesterday, and they advertise it quite heavily on CNN, so you probably have seen that device around. It's not very big. It fits on a key ring. I have one of those devices, and it's very simple. It tells you if you have atrial fibrillation. It tells you what your heart rate is. It's being used a lot now because with COVID-19, people recovering from that develop cardiac problems, and so they're using that device to help monitor patients as well. But it is only $89. It fits on your key ring. It works well, and it's an excellent product, and it's been around a long time. So it's something that, I got to tell you, I was at a large club and gave this talk, and I said, who would like a free ECG afterwards? And of course, I had 30 people line up to have this to do the test. We picked up 3 brand new atrial fibrillations. One guy came, and he was an older man, and he said he was really dizzy and couldn't stand up very long. His pulse rate was 42. So we sent him to the hospital in an ambulance. And these were just people that were at my presentation, and we were doing the monitor test after. So this device works well. Now, the other thing, and this is sort of the same ECG that it does, and this is my ECG that I did with the cardiac device. Now, you obviously are sitting back thinking, well, gee whiz, this is very complicated. If each watch that comes out has to be approved, and each function on each device of the watch has to be approved by all the different countries in the world, this is going to take a long time. So AliveCore has another service that they offer, and this is called Cardiogram. And if you look down here, and this is available on the either as an iOS app or as an Android app, and it's called Cardiogram, and this is what it looks like on the left side. So how does this work? Well, what it does is this app actually takes the information from any watch. You could have a Garmin, you could have a Fitbit, you could have an Apple, you could have any watch that measures your pulse rate. This app takes the information from that device and sends it to their huge computer. They have an artificial intelligence, a big computer in the United States, and it constantly monitors your pulse. And it does this on a continuous basis. As long as you're wearing whatever device you're wearing, it receives the information and watches. Now, in my case, and this is my monitor test that was done in July of last year. Now, if you look here on the left-hand side, you'll see that there's this huge area of red where my pulse was really, really fast. And this occurred around 6:30 to 8 in the morning. And this was very unusual. And you'll see that for some reason my heart rate is up, and it's very different than the rest of the tracing. And so I got an emergency notification from AliveCore because they wanted to know what was going on. Well, in fact, I was playing golf. I golf with my golfing group that morning, and I like to walk, and we walk 9 holes and play golf. So this was not worrisome. But had I had shortness of breath, chest pain, not feeling well, this would have been a worrisome sign. So they are continually monitoring and looking for problems with your heart. This is, if you look here in the center, you'll see that this is the insurance questionnaire, because what they will do is if they do pick up something serious, they will send it to, at your choice, they will send it to your insurance company, they will notify you, they'll send it to your healthcare provider. And so this is a service, and I think it runs around $3 or $4 a month. It's a subscription service. It's not a lot of money, but again, it doesn't matter what device you're using. It will pick it up on all the different watches that are apps or watches that are available. And this is called Cardiogram. This was the app that the fella downloaded and was using on a Fitbit, who picked up his cardiac problem, went to the hospital, got admitted, and the doctor said, you would have died if you hadn't come in. This is what he did, and this is when I discussed that at the beginning of the presentation. This is what he did. Now, I wanted just to go over and give you a little key, a little bit of stock tips here. Clearly, the holy grail of this is being able to measure not only your heart, but to measure your blood sugar, a bloodless blood sugar, and this is the holy grail. Whoever gets this will be the holy grail. And it was in January of this year, this group of researchers from the Samsung Advanced Institute of Technology, or SAIT, and also MIT, were able to do this. They were actually able to accurately and get it approved through the FDA, a device that actually measured your blood sugar bloodlessly. And they used technology, and you don't have to remember this, but this was called a Raman spectroscopy. And this is a device here that will actually, you just put your finger on it and it tells you exactly what your blood sugar is. So we can do this now, and you actually don't need to be poked or anything like that. So my bet is that all the companies, Apple, Samsung, and Fitbit, are all working to miniaturize this so that it will all fit into their watches. And whoever does that will then also control the diabetic market, and the old poking your fingers and all the glucometers and all the stuff that diabetics have to use will all be gone, because this will be a huge game changer. So this will be the next big change in personal health monitoring, will be the ability to have your watch monitor your blood sugar. All right, so let's just go back over what we learned today. We learned the goal of this presentation is to monitor your heartbeat. You need to know if your heartbeat is too slow. You need to know if your heartbeat is too fast, and that is atrial fibrillation. Just to refresh your memory, this is the pacemaker insertion at age 60. I want you to always remember the graph, and that's the chance of you having to have a pacemaker as you get on in years. Atrial fibrillation, a major cause of stroke. Again, age 60. Look at the graph; it's the same. So, as we age, we often have cataracts, and we need cataract surgery. We sometimes have arthritis in our joints, and we need joint replacement. Well, we also need to look after our heart, because these are serious problems that can occur, but by monitoring them, we can often prevent very bad complications. We're going to talk in part 2 about all the other devices that we could put in Mary's house that would help her with clearly one of her big problems is she lives alone, and she lives in a resort where there's not a lot of people around. So what devices can we put in there to help her with the isolation that she has? I gave this talk a couple of months ago, and someone said, "Doc, what should be the moral of the story here?" And I said, "What?" He says, "An apple a day keeps the doctor away." And I thought, well, that's sort of cool. So I put that in my presentation, and I'm going to stop now yakking on and on here, and I'm going to open it up to any questions that you might have. So let me just stop you can unmute yourself now. And if you want to unmute yourself, and I'll try and look and see. I don't know if I can see everybody. I see Jerry's got her hand up. Why don't we go with Jerry first?
Actually, I'm Joanne. My husband's Jerry.
Okay.
What I was wondering is, have they shown any hereditary component to AFib? The reason I'm asking is my mother had AFib, my father didn't, but he had other heart complications. Yeah. And I was wondering if, since my mother had it, should I be more worried about it, or is it just something that happens with aging? I also noticed.
I think the answer to that question is both. There are conditions with your heart, and particularly the electrical system of the heart, that would predispose you to atrial fibrillation. So there could be a hereditary component there, for sure. And so that would be something that you would really want to be on your toes about and watch for this, right?
Thank you.
Ron?
Dick.
I'm 83 years old. About 15 years ago, I was diagnosed with LBBB. If the right bundle quits, will the Apple Watch tell me I've got a problem?
No, but it would tell you. It tells you your rate, and if your right side quits, your rate's going to slow. Do you have a pacemaker?
No.
Yeah. So what you would really want to make sure is that that your heart doesn't slow down. And one of the things that we do is monitor your heart rate to make sure that it's staying whatever your rate is today. It's really quite interesting when you start wearing these devices. Those of you who had Fitbits, you know what your heart rate is. I mean, I never used to know. I mean, it goes. You just do your daily stuff. But when you actually have a watch and it tells you what your rate is, you look down, you sort of learn what your rate is and what your normal rate is as you go through the day. And if you feel a bit weird or dizzy or something happens, the first thing I look at my watch, and it tells me exactly what my pulse is. And you'll know if it's different or if it's weird or if it's really slow or really fast. You'll know right away. And that's enormously helpful to your doctor. The nice thing about the Apple Watch is when you take an ECG, when you push that button on the crown, it records it. So it not only can you look, and you can look at the watch, when you click that button, it records it. And that's what you can take into your doctor and say, "Hey doc, this is when I was feeling that weird, this is what it was doing." And that's enormously beneficial when you are looking at. Look at Mary. She went in twice and she had that little bit of a dizzy spell. couldn't find anything. And that's the same with your car. You know, you take your car in, it's got an electrical. I usually just trade my car in if it's got an electrical problem, because they can never figure out what's wrong with it, right? You spend hundreds of dollars trying to figure it out because it's intermittent. So that's hopefully that answered your question.
A second quick question. With any of these wearable devices, if they come out with a new function, do you have to buy a new watch, or is just a software update?
Software up. Most often a software update. The Active Watch 2, which is a Samsung one, they're going to be bringing out it's a blood pressure monitoring that will be able to be done through the watch, and it'll just be a software update. And in fact, the Fitbit, they didn't even know that Fitbit could diagnose atrial fibrillation. I mean, they had no idea. It was only until they took out the person from AliveCor and brought them on stream when Google bought it, and they said, hey, the software is already in the watch, and we'll just do a study, and for sure it's going to show that. So it's all in the software.
Okay, thank you.
Okay, I got 3 questions.
Sure, go ahead.
Okay. Number 1 would be security. Is this just a product to extend their existing products to you, where you are the product already? Are they going to be selling your information, marketing it, targeting you for you need to do this medication?
Oh, for the medical study, you're talking about the medical study?
Security studies.
Security.
Are these devices secure in sharing your information with everybody?
So the Apple Watch doesn't share your information unless you participate in a study. The Apple Watch doesn't share your information with anybody. And in fact, as you know, Apple has a very good security history of security.
The phone, but I don't know about if the watch can be hacked.
Yeah, I would doubt. I think the Apple is very secure. I've seen no information about that at all. Apple usually is very secure.
Okay. With Google, it's like everything Google touches is a product, or they sell it third party. So I'd be concerned about, watching the terms of use on Google versus Apple.
Sure. Well, let me just answer the follow-up that we haven't seen the final chapter in the Fitbit. The whole Fitbit line is going to change. The watch, the concept of Fitbit, what it does and how it works is all going to be changed this year in newer models. So it's a good point that you bring out. I don't know the answer to that, but for sure, in terms of service, will all be different for sure.
Okay, a couple of years ago, McAfee did a analysis in Europe on a marathon where they set up sensors in the marathon to be able to detect and find out if they could identify the users of the watches. And the report said that they could not only detect the users of the watches because they had personal information on the watches, but they were able to track them through the whole race.
Yeah, I don't. I just haven't seen.
That's just a separate side. Another thing is the devices are written on the arm, and we do blood pressure checks and pulse checks on the forearm, or on the forearm, between the elbow and the shoulder. And then you got devices that wrap around the chest. Like I have a pulse heart monitor that I use for training, and I've been using that product for about 20, 30 years as I overtrain. I understand that the Apple Watch has a lot of inaccuracies because it is further away from the heart than a strap would be, or a blood pressure cuff. Can you speak to that?
Sure.
About the accuracy?
You're probably talking about two different things. The first of all is measuring your pulse, and measuring your pulse is no different. No matter whether you measure it on your chest, listen to your heart, whether you listen to brachial, or whether you do it on your toe, your pulse is always the same. And it's extremely easy and accurate to measure your pulse. Any device that puts on your end of your finger will measure your pulse. So your pulse is not, is simple, and that's very accurate. The point you make about blood pressure is true, because the blood pressure around your chest is different than in your arm, it's different in your leg, it's different in your ankle, right? But the Apple Watch does not measure your blood pressure. It only measures your pulse. It does not have a blood pressure feature. The Samsung Active 2 is just bringing in a blood pressure monitor on the watch. And how that works is basically they're looking at the waveform of pressure as it goes through the arteries. And so what it does, actually, you have to actually measure your blood pressure with the brachial cuff. So to standardize it, you actually take a blood pressure once a month. So on your arm, you take a blood pressure and you measure it, and you say to your Samsung watch, my arm pressure at now is this, and you put that into the watch. And then the watch actually measures the differential in pressure. So we are getting brachial pressures with that. And that's sort of how it works. Because you're right, it's different in different parts of your body. And all the studies have all been done with brachial, not pulses on your wrist. So I hope that answers your question, but they have addressed that issue, and you have to standardize it. Be very wary of devices. If you go on the internet, you can find watches that for $35 that'll measure your blood pressure. It's all bogus. It's all false. It's all measuring your blood pressure is on a peripheral device is very complicated to do. And the Samsung Active 2 is the first watch that's actually going to do it in this format. There's one other watch out that actually has a bladder inside the watch. It's about $400, and the bladder actually pumps up inside the watch and does a blood pressure like that. I can't imagine why anyone would want that, but anyway, it does do it. But be very wary. If I get these all the time, people send me, what do you think of this? And it's a Chinese watch that for $35 and says it does your blood pressure. Not true. Not true.
Okay. The third and last question I have for you, give the floor over to somebody else, is insurance. Okay. You posted like 3 different insurance companies that, and that's going to be changing. Do you see a point that Medicare will pick up the cost on this stuff?
Oh, sure. I think as the value of this gets, look at Mary. If Mary had a $400 watch, she wouldn't have had to go to the emergency department. She wouldn't have broken her hip. She wouldn't spend all that time in ICU. Wouldn't need all the rehab afterwards. So it would save the system an enormous amount of money, right? So I would think that for sure that's going to happen. But bigger than that is the blood sugar. That is going to have an enormous, because the cost of a diabetic in measuring their blood sugar and poking their fingers and all that sort of stuff is probably $2,000 or $3,000 a year. And so that's going to be an enormous holy grail, whoever comes up with that. Yes, Tom.
2 things. How far are we away from percutaneous blood sugar measurements? And then also, is there a place on the FDA website to look up the certification and the certified capabilities of different devices? For example, Apple Watch Series 3 or Apple Watch Series 4 is able to do A, B, and C, is certified to do and can be trusted to do A, B, and C. Is there a medical device certification page for consumer devices?
I'm sure there would be, but I have no idea. I do not know the answer to that. I can't tell you. I can't tell you that. There probably is, but I don't know.
And the first question: how far are we away from percutaneous blood glucose membership or measurement?
Well, I'm not talking about percutaneous. We're not poking anybody. We're
Oh,
talking
okay.
about
I meant trans, the
right.
cross.
Well, I think we're very close. In fact, you know, I meant I read it last week. There was it wasn't Apple that came out, but there was some company that I hadn't heard of them, and it was a news report that came across the wire service that they were bringing out the watch that had been FDA approved and it was for blood sugar. Now I don't know the company, and I just came out over the wire service last week, and I haven't really had time to look at it yet. But it wasn't any of the big three. I didn't know who this was, and I can't answer that, but it's going to happen very quickly. I think within the next year or two, you're going to see your watch, without poking you, will be able to simply, as well as giving you your pulse, it will be able to give you your blood pressure and your blood sugar, and that will have enormous consequences to healthcare. And that situation, I would think these devices will be more and more valuable, and your healthcare providers, I'm sure, will. But even at that, let me tell you something. If you buy an Apple, if you have an iPhone, and one of the things about interesting in the United States is 50% of the phones sold in the United States are iPhones. So the chances of you having an iPhone are 50-50. So suppose you do. Half the people in the United States have iPhones. So if you have an iPhone, is $400 really that much to prevent having a stroke? If you have a stroke, you're going to lose your driver's license. You're going to end up in a care home. It would cost you hundreds and hundreds of thousands of dollars, and your lifestyle's all going to change. For what? I never met anybody that had a stroke that said to me, gee, I wish I hadn't spent $400. You know, it would have been, it's just such a small amount for such a huge savings. So I can't imagine anybody who has an iPhone saying, I'm not going to spend $400 on an Apple Watch. I really do passionately believe that you know, if you have an iPhone and you're in the Apple system, you definitely should have a watch. So I hope that answered your question, Tom.
Thank you.
Now,
guess we're out of time. Huh?
No, I can stick around as long as you guys want. I don't care. Leo, did you have a question?
Am I understanding you right? You think pulse is more important than blood pressure?
No, they're both important. We haven't been able to measure blood pressure with a watch before, so we're measuring. You know, we've got the pulse thing organized, but we're going to be seeing more. I thought the Apple Watch 5 would do blood pressure. I don't know why they didn't put it in with the 5. I suspect it'll probably be in the Apple Watch 6.
Well, so now in my situation, the cardiologist said I should be okay. I have a very, very low blood pressure, but the doctor said that when I'm in my 90s, he figures I would need a what do you call a pacemaker, because it's so low. But unless something changes, but so when a case like that, do you think when the iPhone would help?
Well, certainly the Apple Watch is going to measure.
Apple Watch, I mean.
Yeah, well, because it's going to tell you what your pulse is, right?
Keep better
control on it.
Check on it, yes, yeah. You're a cardiologist, I guess, right?
No, I'm not. I was a flight surgeon in the military, so I did a lot of cardiac work, but I'm not a cardiologist.
Oh. Yeah, it's very interesting.
Yeah. So, any other questions?
We got 11 o'clock talk too, so.
Okay, well, I'll let you guys go. So listen, thank you for listening to my presentation. It's being recorded, which I'll have up on the web, or up on YouTube this afternoon, and then and I'll send you a copy of the link, and then Lisa, I'll send Lisa the link, and you can do that, and so all the information is there. And part 2 is where I look at home networks and devices that Mary could put in her home to help her with safety issues. So we look at home networks and how all these things can help her, and what you could do for her to make her environment more secure and safe. And that's what part 2 is all about.
So are
You know,
we
Doc,
gonna have part 2?
Pardon me?
Are we going to have part 2 as part of a later meeting, or you just?
No, not today. Someone's got to request it through APCUG. Lisa hasn't. No one's requested it yet. I just finished the presentation this week, so it just sort of become available. But you can book it now through APCUG.
Thank you.
I'll,
You need to get a hold of Lisa.
listening,
Pardon me?
if Lisa's listening, I'll certainly second any request for that right now.
Right.
I've looked at the Medline search and a literature search for fall detection. Family members, neither of them wear watches, never have, aren't going to change now. So I'm primarily looking, and both of them are Android device users. So I'm primarily looking at, out of the variety of course, there's fixed place fall detection, which you're talking about home network and surveillance in the home. Had a family member just on a walk take a stumble over an uneven sidewalk, go down with some damage and abrasions and a bit of a head strike, and not too sure. Fortunate for good neighbors, but the one thing that they often have on them is their phone, and that's the thing that I can kind of rely on.
1 2 6 9, Barbara. Channel 1 2 6 9.
Trying to have you, for part 2, do you have much on mobile device or on phone fall detection and the certifications, or what do you know about that?
Yeah, we'll talk about that in part 2.
Well, I'll raise my hand and request it for anybody who's listening.
All right.
Thank you, sir. Thank you very
Okay.
much, Doctor.
Okay. Well, we'll talk to you everyone soon, and have a nice day and enjoy the rest of your meeting.
It was great. Thanks.
Okay. Bye-bye now.